I'm here with our guest this morning as we talk about our COVID response. Dana Hawkinson, our medical director of infection control, and one of our outstanding infectious disease physicians. And this morning we're joined by Rachel Pepper, who is our vice president, our chief nursing officer here for the University of Kansas Health System. Wanted to welcome everybody in. Today's count, I believe it's actually last night's count. We don't have this morning's count up yet, but we had 36 patients in our hospital with COVID-19 from the SARS-CoV-2 virus. 11 of those patients were on ventilators, and I believe 14 or 15 or so were in the intensive care unit. We'll have this morning's numbers. They come out a little later, and then we have another set that comes out later in the day as well. That's an increase. We are seeing a slow increase and a slow rise here at KU. And as we look at that rise, Dana, we know that's kind of a sign that we're on the we're beginning to ascend. I wouldn't say we're on the rapid ascent part yet, but we're beginning to get there.
Yeah, that goes exactly to what I was talking about. You know, we are now reading even more articles or see even more news stories about nurses and not having enough PPE, protective equipment. And there was a TV show last night where the anchor had interviewed a critical care nurse from Georgia, and she was doing well, and they had plenty of protective equipment. But we look at other colleagues in New York and Indianapolis where they don't. And he was talking to her, and he was just like, we're with you, we support you, what can we do for you? The biggest thing we can do is stay home so that our nurses and our respiratory therapists and our physicians don't have to deal with the surge like Indianapolis and Louisiana and New York have had to deal with. And if we do that, we will have plenty of protective equipment. You know, even last week or so, Louisiana thought they had missed the surge. Now we see they're full in it. So it's vitally important to keep your loved ones safe, your loved healthcare providers safe, your nurses, your respiratory therapists, your physicians, and everybody else who's helping care for these patients. Stay home, stop the spread, try to flatten the curve, and that's really the message that we're kind of putting out there day after day.
Rachel, the nursing profession here is outstanding. We have some of the greatest nurses in the world. How are folks doing?
Well, thank you so much for inviting me today, and our nurses are truly doing great. We have such a strong and resilient team, and there are a lot of things right now that feel uncertain or are changing, but what I see nursing doing every day is it's truly what they do very best. Our nurses are focused on their patients. They want to be there to support every single patient and give them the most safe care that they can. They're working as a team, and they're constantly sharing thoughts and ideas and concerns that they have with all of our colleagues so that we can become better together to take care of these patients and truly improve the health of everyone. I think our nurses are feeling that outpouring of support from the community every day, and they're so incredibly gracious for that. They're proud to take care of our patients. They would also ask the community to really embrace the power in every single person's hands by staying home and socially distancing and washing your hands, as both Dr. Hawkinson and Dr. Stites have shared. We truly are all in this together.
Yeah, you know, if you want to shape your future, shape the curve, right? Yeah. If you want to shape your future, shape the curve. What questions do y'all have this morning? You know, if you don't ask questions, I get to blabber on about something, so you got to ask something.
Hi,
Go ahead.
Go ahead. Sorry, I haven't been on here before. I'm Greg Kozel from the St. Joseph News Press, and we cover the eastern part of Kansas a little bit. I was wondering if you could speak a little bit to, from your perspective, how prepared some of our rural hospitals might be for a possible surge in coronavirus patients.
You know, that's a great question, and thank you for that. We have this teleconference once or twice a week with different groups. There's a CMO group here in the Kansas City metropolitan area, but we did a conference last week where we opened it up to CMOs from Western Missouri and all of Kansas, and I think we had over 150 chief medical officers there. And then we have the Collaborative here in Kansas, which is a group of hospitals that work together to help improve and educate and do things. It was started the CMS project here at KU a few years ago. And there are 200, and when we opened that up to hospital administrators and physicians and folks and nurses, and there were over 250 people. And we did that again yesterday, and it was sort of a combined of both groups. And we had over 250 people. We had an hour-long conference. Folks asked great questions. What I know is that the rural hospitals tend to be running about 2 weeks behind the Kansas City metropolitan area. So we're trying to push our experience out there so folks can learn from that, whether it's about the right infection control techniques, the right PPE, the right care of the COVID-19 patients. And I think that folks really have achieved liftoff there. They're asking all the right questions, they're doing all the right things, and they're trying to get prepared. What we know is that when patients get really sick and they have to go on ventilators, that many of our critical access hospitals with that may have an average daily census of 1 or 2 or 3 and may not have an ICU, they're not really ready for that level of care. And so what we've been working on is when's the right time to transfer patients over to a higher level of care in some place that can run ventilators and has more experience around that. And so we've been trying to shape that, and I think that that's been a good conversation. We'll keep doing that, and we'll keep trying to push information out. But I do think the rural hospitals are rapidly gaining in knowledge, in part, as we all do. As things get closer to you, you get more prepared for them.
This is Melissa from Channel 41. Bouncing off of that, without getting into politics, there is not a statewide ban in Missouri. However, we've been hearing from some viewers who live in like some of the outlying areas, such as Cameron, who say residents there are saying this is a big city virus, meaning Kansas City and Missouri and St. Louis. However, we know that that's not the case. What would you say to those folks who live in the more rural areas who feel as though this is mostly a big city, suburban type virus, and they don't have to be worried?
I'm going to let Dana take the first shot at that, and then I'm going to tell a story. Go ahead.
This is a good question. This happens over and over with many disease processes, many other issues that come up, whether they're economic or anything like that. This is a big city or this is a rural issue. This is a everybody issue. The virus doesn't care how much money you make. It doesn't care what your job is. It doesn't care really where you live. It gets around to these places, and it gets in these communities. And I don't have to talk about the countless number of small rural towns around the nation that are affected by this virus. So, certainly things can be done at the state level. Mayor Lucas has been really proactive here at the local level for Kansas City, Missouri. Things can be done at the county level and at the city level as well. And so I would urge those leaders of those small or rural areas to really look at the evidence, really look at what's going on in other areas, maybe in other rural areas out east around New York or out west, and really see what's going on and make that decision for yourself and try to make the best decision and put in mandates or really encourage your constituents and your local residents to stay home and abide by the same types of things that we're doing in this big city, because the virus doesn't care where you're living. It has shown that it can get anywhere and can cause havoc in any area. So,
yeah, I would remind us that the virus has already jumped an ocean, right? It already jumped an ocean. And went to Seattle. That's a big city. It's bigger than Kansas City. Went to New York City. That's a really big city. So maybe we thought it was only going to be in that size city. But this virus jumped an ocean, left Seattle, left New York, made it to Chicago. New Orleans looks like they're in trouble after Mardi Gras and people being so darn close. It's in Kansas City. It's in Wichita. It's in Lawrence. It's in Topeka. I don't know why anybody would feel safe. It doesn't care where you live. What it cares about is that it finds a host that it can infect. And I'm ascribing sentient being to a virus, and it's really not like that, of course. But the point is still the same one. it's coming across the country, and to think it's only a big city virus is really hopeful thinking, but it's not true thinking. And in this case, that hopeful thinking will get you into just as much trouble as all the people in all those communities where the virus already is, who thought maybe it would stay in China or maybe it would stay in New York and Seattle. And it didn't do that. It's going to come to a theater and to a town near you. Next question, please. Okay, I'm not hearing a question, so I'm going to ask Rachel. Rachel, do you feel like our nursing staff thinks they have enough protective equipment?
Our nursing staff does feel like they have enough protective equipment. I think they know and see every day that we're focused on keeping up with what the CDC recommends as protective equipment needed to take care of our patients. And in addition to that, we're working hard every single day to conserve our PPE so that we have it for the long haul of this disease as we take care of patients, and we are prepared to protect our staff as they care for every single person.
You know, and I think over the next week, we're going to have a lot more information. You know, pandemics, you know what, they make you feel dumb, right? They make you feel dumb because the reason there's a pandemic is we don't have enough science to have contained the virus to start with. If we'd had the science, we would have had a vaccine, we would have had treatment, so we didn't have that. So we have a little bit of knowledge, there's a whole lot of fear, and so we have a virus that spreads relatively easily compared to other things like Ebola. And so as a result, we have a pandemic. In the midst of the pandemic, you have to do your best to prepare. So what do? You try to conserve as much of this equipment as you can, following the guidelines of the CDC and the World Health Organizations and learning from Wuhan. I've said before, we spent over an hour on the phone with people from Wuhan at the leading academic medical center in that province and asking them, tell us about how it affected you. Tell us about what you did to make sure your folks stayed healthy. And it was the essential PPE. They did have healthcare workers getting sick until they did the gown, glove, mask, face shield. And those are the basics. And we know then they said, gosh, we didn't have any more healthcare workers getting infected. And that's why we're doing our very best to conserve that equipment so we can keep our people safe.
Dr. Stites, I might add to that. Last night I was visiting with the nurse manager and talking about what does caring for the COVID patients mean to nurses and how is it different than what we've always done? And she shared this really great story about there's been incredible silver linings throughout this journey, and one of them is it's deepened that patient relationship with nurses in an even bigger way. It's not common that you're learning about a disease at the same time as the patients are. Information continues to evolve about COVID and how we treat it, and so we're in this together, and we're taking great care of our patients every day, but we're really finding new and different, deeper ways to support and connect with them because the patients and the healthcare providers are truly on this journey at the same time together.
You know, Rachel, that's the best. I just have to say, so I do cystic fibrosis patients, and you'll know this story, but we had a floor of patients of the hospital that took care of RCF patients. But for a variety of reasons, for infection control reasons, we had to move our CF patients so that team of folks could start taking care of COVID patients. And you know, they were sad to see the CF patients go, but they know in the long run, they want those folks to come back, and they embraced taking care of the COVID patients. And the next thing happened was one of our other wards, which takes care of pulmonary hypertension patients, had to do the same thing. And the next ward that usually takes care of transplant patients is now doing the same thing. The pictures from the teams of nurses from when they said, okay, we're moving your normal patients, we're bringing in these COVID, man, they're rallied and they're ready to go. I can't say enough about how the nurses who are on the front line of this are doing just a remarkable job of embracing folks who are, you know, could be scary to some patients, right? These COVID patients, they can be scary, but they've embraced it and done a remarkable job of caring for it. Hats off to you and your team. It's been fantastic.
Thank you.
As it always is here.
Thank you.
Questions?
This is Melissa again. I have another question, and I don't know if you can answer this, but now that we have 3 confirmed cases within the Kansas City, Missouri Police Department, has that department been in touch with you about changing any your input on, you know, whether or not to change any of its current policies on policing now that they have 3 confirmed cases, and I think at least 25 people in quarantine.
Yeah. Dana, I haven't heard that, but have you?
I haven't. You know, they if it's Kansas City, Missouri Police Department, obviously they have access to the state health department, the Kansas City, Missouri Health Department. You know, I know some colleagues working there very hard in late hours, so they do have access to that type of information and help. Should they need it as well.
Yeah, we're obviously ready to stand by. I don't know of any
Yep.
reach outs so yet, so that doesn't say also that it hasn't happened. It may be that I'm not aware of it. So,
Thank you.
other questions? Okay, well, I got another story to tell. So, and I always have a lot of stories. So last night I had I have a very good friend who is kind of has a similar position to what I do down in Texas, and she's down in Dallas, and I was speaking with her, and we were comparing notes. So Texas went to a shelter in place about 10 days before Kansas did as a state. And all along, she said, yeah, we're a week ahead of you guys in this crisis, which has been true. If you look at the data, their number of COVID patients was on the rise, and they were scared, and they were doing all the preparation and trying to count all the ventilators and doing all the things that they needed to do. And at one point, they had like 35 or 40 patients when we had 15 or 17 patients, something like that, and those are about the right numbers, but they were clearly ahead. So last night we were talking, and I said, so how many patients do you have? And she said they have 17. Now we have 36. And the difference is that they have this very strict shelter in place in Dallas, which is a very large metropolitan area, right? Very large. And this is the story. The story is that with shelter in place, they flattened the curve. It's what we're trying to do here. For anyone who doubts that shelter in place and staying home and not having a lot of public gatherings, if anyone doubts that it works, you're wrong. It clearly works. Now, there's a social cost to go to that, and I'm not the Politico, so I'm not going to say everybody has to go shelter in place. Jobs are real, the economy is real. But what I can tell you is that if you want to shape your future, you have to shape your curve. And the only powers that we have to shape a curve in this pandemic, which is unlike anything any of us in our lives have experienced. You have to go back, and there are a few folks I think still alive back in 1917 and 1918 with the influenza pandemic at that time. But otherwise, this is the challenge of our lifetime. Mm-hmm. I saw an article today that compares it to World War II because of its international scope and the number of people who are likely to die. Shelter in place works. And if you want to shape your future, then you have to shape the curve. And the way to shape the curve is to stay home. Here in Kansas City, we will know a lot more because we haven't had a lot of testing. And we haven't had enough kits to do all the community testing. And there are some efforts to do more so we can at least do some random samplings and see what the community spread is. But the way we have to track the data is by the number of hospitalizations, which are about 10 days behind, 7 to 10 days behind the number of people who are infected. So our data will always be a little delayed as long as we depend on that. But we will know a lot more by the end of this week and especially into next week of whether or not shelter in place in Kansas and the core 4 area, Kansas City, Missouri, Kansas City, Kansas, Wyandotte, Jackson, Johnson, whether or not we're having the effect that we hope and pray that we are.
Yeah, I would agree with you. These are tough messages, and this whole infection and everything that we're going through is tough. We're not the University of Kansas feel-good system. We're the University of Kansas health system. And what we're trying to do is arm you with the facts, the transparency about what's going on here at our health system, about what's going on with our providers and our PPE, but also what's going on with the virus. Arm you with the facts so you can protect yourself, protect your loved ones, and flatten that curve. And that's what we are trying to do every day. And we are not trying to be mean. Dr. Stites said it works. Shelter at home works. Staying at home works. Nobody wants to do that. That's hard. That's hard emotionally, physically. You know, we are lucky. We get to come to work every day. A lot of people do not. But these are the facts that work. And as we do these, we are able to see the light at the end of the tunnel sooner, hopefully, than what we would have if we weren't. And those numbers, those projections keep coming out day after day saying this is what would happen if we didn't do any of this stuff. And this is what could happen if we do this and are strict in doing this. And so we are not obviously trying to be mean and cause fear. We're actually trying to arm you with the facts so that you can take that back to your loved ones and your friends and get a grip and a handle on what needs to be done so that we can stop this.
Questions?
This is Taylor at Channel 41. I've got a question for you, Dr. Stites. You had something you said at a press conference a couple weeks ago that's gotten a lot of play, obviously, about being able to watch the Royals this summer and being at the K. Obviously, you're not the commissioner of baseball, so I don't expect you to have the definitive answer here. But have you, based on what's happened the last couple of weeks and what you expect to happen over the next 10 days or so, do you still feel confident that's going to happen? What's your lay of the land moving into the summer?
Man, that is just a great question. I don't know the answer to that question, to be really honest. I think that baseball will be back this year. I don't know when it's going to be back. I don't think it's going to be in June. I think it'll be more toward the late summer. And obviously I want it to be back. I love the Royals and I love baseball and I love the K. And so I think it will still be back. I just think it's going to look different. I don't know how many people we'll have in the stands. I just, there's just not enough to know yet about how this is going to go. But I am still optimistic there will be some baseball here in Kansas City in 2020. I don't know what it'll look like. But I think we'll have something happen. We have to be socially responsible. It'll be a while before we'll be back to normal. It's going to take probably a vaccine and other therapies to make this a little less scary. But I think we're going to get there. Great question, by the way. I'm glad you listened.
This is mostly, again, as a follow-up to Taylor's question. Yesterday, we talked about, and I know Fauci, I think, mentioned it, that there's a good chance we'll see this virus again come August. Now that we're talking about baseball, what does that look like?
For Kauffman Stadium, or for the health of the public in general?
Just overall. Yeah. Overall, right now, obviously, we're staying home. But
yep.
What is
yep.
If we are going to see the virus again come August, if that happens, are people going to be able to feel comfortable leaving their house? Is it just going to be like a sporadic?
You bet. Let's take that head on. Let's talk about head on. First of all, I think there's a medical question and then there's a social question. We'll try and do our best to do social stuff, although I may not be the best social person in the world, but let's try the medical side pretty well. All right, Dana.
Yeah, that's a great question about the virus. That was one of the first questions that came up when we started doing these things. Will it come back? It's like the flu or it's like the other cold viruses. It will be seasonal and leave. We said we didn't know. We didn't know if it would persist throughout the summer. The southern hemisphere is now starting to have a lot of cases in many, many countries. Now, I did hear Dr. Fauci within this last week certainly say things that we were saying, and consistent with that is, well, maybe it will be seasonal like influenza and come back. We certainly know the 1918 influenza came back later as well. That's a scary thing, but there's a lot of aspects and a lot of directions to take with that. Hopefully we can build up our supply chain so we can have PPE. Hopefully we are getting closer to a vaccine or actual therapeutics that are approved and actually show efficacy and safety in working against this virus. But there is a huge concern that as it is in the southern hemisphere now, it may cycle back and certainly come back into the northern hemisphere in the fall as well. So that's a very real concern.
And as we see it again and again, there does get to be some immunity when you've had it before, we think. We don't know that for sure yet. So it is a great question, and unfortunately there's not there's not enough knowledge about how this coronavirus is going to act. It's also very possible that, as did SARS-CoV-1, it may come out, it may cause a lot of issue, but then it may not come back. We haven't seen another outbreak really of SARS-CoV-1. So it wasn't, that particular coronavirus wasn't as transmissible as this, but transmissibility isn't the only thing that determines whether or not that virus is going to be around again. So the rules will all be the same. And the second thing is, when viruses come back, sometimes they're not as hostile as they were the last time. They're more mild flu years or more serious flu years. It's all influenza virus, but it does change a little. And so there's just a lot of things we don't know, and we won't know until we've been around this block a couple of times. What we do know is that it takes a lot less time today to produce a new vaccine and new therapies than it did before. If I think about the AIDS epidemic of the 80s, it took us 15 or 20 years to develop effective therapy. If you look at some other infectious disease processes, and now when they come out, therapy comes around much, much faster than it did before. And with the amount of research and effort going on around coronavirus, or this particular novel coronavirus, my sense is that that science will come on pretty hard and pretty fast. And I think that's what we're fortunate to live in, this age where every scientist in every country around the world is devoting research and time into trying to determine how best to combat this virus. Rachel, do you have a sense amongst your team about overall morale and about how they're looking at this story right now?
I think nursing morale is good and strong. I see nurses everywhere truly embracing this as this is what they do every day. They step up and they take care of patients, and I think they're being innovative in care. This time it's different. We have to limit visitors for the safety of everyone. So nurses are finding ways to try to support their patients and connect with families via technology methods and during physician rounds and updates, or as PPE recommendations evolve and change, the nurses are constantly adapting to that. And what I see is this incredible positive spirit, truly focused on having that deepest sense of team circled around our patients and really supporting our community that has a need, and we want to fill that need.
That's why we have great nursing care. I mean, that is. I know my patients who are hospitalized right now feel that, and that's been a great development and out of this. Other questions? Okay, Dana, last thoughts.
Stay at home, wash your hands, don't touch your face. I've answered a lot of questions about this. Again, your chance of getting infected is exponentially reduced, especially if you're out at the store or walking around. If you have good hand hygiene and you're not touching your face, and social distancing, staying away, physical distancing as much as possible, because hopefully we can stop the infection, flatten the curve, and ultimately save our PPE and keep everybody, our healthcare workers, our nurses safe. And that's the last message.
Rachel, anything that you wanted to add today?
I want to say that I'm incredibly proud of our nursing team here at the University of Kansas Health System and of nurses everywhere for doing their part in fighting COVID and supporting our patients. I want to thank our community on behalf of the nurses. Our nursing teams are feeling the love and support from our community every single day, and it means so much. And what I would ask, and every nurse would ask, is to truly do your part in helping us take care of patients by flattening the curve, staying home, socially distancing, washing your hands. We can do this together.
And my story is this. Every day, my wife and I take a walk. Now, we didn't used to do this, but we have a little more time right now, early in the morning to do that. And we take our dog on a walk, and we go through our neighborhood. And what I am impressed by, whether that walk's in the morning or at night, what I am impressed by is the creativity and the ingenuity of the human spirit. So, in the windows of the homes we pass by, or teddy bears or polar bears or different stuffed animals, so kids can walk the streets and see that and have sort of an enriching experience. The sidewalk art is remarkable. there's a little fairy house that someone had built near in our neighborhood with stepping stones. You have to you paint. They left the supplies that you paint, or you chalk the stone, and they create a walkway up to that fairy house, and everybody makes a contribution to it. These are hard times. They're hard times for healthcare. They're hard times for all of us, but we're going to get through it. And part of what's going to help get us through that, whether you're in science or you're at home, is the ingenuity and creativity of the human spirit. And what we want to do is to channel that into unique and different ways that make staying at home not only a challenge, but in some way a good thing. Because at the end of the day, when we come out of this, it will have been that degree of commitment to doing things to help flatten the curve that allows most of us to get through this okay. You want to shape the curve? Stay home. As they say in Kansas, there's no place like home. Thanks for your help. Thanks for your talking today. We'll talk to you soon. Bye-bye.